Be careful with what you see on social media.
Dentistry doesn't get cheaper with time.
I haven't seen my retainer in 20 years. Makes sense why my bottom teeth are just completely shifted.
I just mentioned I'm in dental school and it opened up a whole can of worms.
Don't recommend charcoal. It can cause like darker gums.
Cavities do grow a lot quicker in baby teeth, motherhood, dental health, and your baby's dental health.
I think I'm going to fall into those 40-year-old women who are getting Invisalign.
Usually by the time the tooth starts hurting, there is a bigger issue going
Like something out of a sci-fi movie.
Hi, everyone, and you're listening to You're a Doctor, Right? The podcast that answers all of your burning medical questions. This is a really special dental episode, and I'm so excited to introduce my brilliant and beautiful family members who are all dentists. So starting from the lower left hand, we have Dr. Isabella Bole, who is in dental residency, Dr. Serena Bole, who is a practicing general dentist, Dr. Nina Bole, who is a practicing pediatric dentist, and Claire Bole, who's in dental school. And we have Ashley Bole, who took the road less traveled and became a lawyer. But actually, I remember from talking to my parents this weekend, our grandmother actually was one of the first lawyers in her village in India. So Ashley's a trailblazer like her and carrying on her legacy as being a lawyer. So here is everyone. I'm so excited to introduce you guys. And as Ashley and I always led all the Cousins Club meetings, I felt like it was only appropriate for Ashley to be asking the questions today to all of our cousins. So this episode of You're a Doctor, Right, led by Ashley Bole and I, and this Cousins Club meeting is now in session. Let's start this off. As you know, the premise of this podcast is basically questions that we get in different social settings. So when you're out, or if you are, dropping your kids off at school, people kind of pull you aside and say, "You're a doctor, right?" and ask a question. So in lines of that, I wanted to kind of start with, what are the most common questions you guys get from being a dentist? Anyone can answer. Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because it's something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today.
One I get a lot is like, is teeth whitening, bleaching safe? Like, what products should I use? What do you recommend? That's probably like my most common. People like to ask about the cosmetic side of it and if bleaching is a good option for them.
And what's the answer to that? Because I actually have that question all the time. I'm literally constantly Googling this question. I should just pick up the phone and call you guys. So what should we be doing for teeth whitening? Because your teeth look beautiful. They are curly white. So whatever you're doing, I want to do too.
So I do the in-office whitening. In general, teeth whitening is very safe. You can't overdo it, of course, like any nice thing in life. You don't want to get really bad tooth sensitivity or gum irritation. If you're looking for a brighter boost, like a more dramatic difference, I would recommend like an in-office whitening session with your dentist. But there are some really good over-the-counter products for you. So I would recommend looking for a product that has the ADA, which is the American Dental Association approval.
Okay.
And then it's safe and effective. So Crest White Strips are really good for an over-the-counter option. They're always going to be more subtle than an in-office whitening, but overall, I would say it's pretty safe and you can't go wrong as long as you're getting something that's approved by that.
Are there differences in sensitivity with like in-house or home?
Yeah, so everybody's different. Some people may be very sensitive after whitening and some may not be. The in-office is probably going to be a little more sensitive for you. So it's usually just like 2 to 3 days to a week, depending on the person. It's not really something people can't handle. It's just like when you're drinking cold water, you'll feel like, ooh, okay, that's a little sensitive, but beauty is pain. So usually people will tolerate it for whiter teeth.
Bella, what about the natural whitening products? I've seen those promoted all over social media, like charcoal, toothpaste, and
so
rubbing on, on your
I would
teeth.
be careful with what you see on social media. You always want to talk to your dentist about any new trend that's going on. I don't recommend charcoal. There is, it can get impregnated in your gums and actually cause like darker gums. So scary stuff. You definitely want to, with any social media trend related to healthcare, you definitely want to talk to your medical provider to make sure that what you're doing is safe.
I love that Ashley, she's our Cali cousin. She's always asking about the natural stuff. So I think that's such a good question because I see that keeps popping up on mine too. So I was actually curious about the charcoal stuff myself. Okay, what about for kids? So I noticed, and I'm wondering, Nina, if you get these questions. I noticed that my son Asher, as the listeners know, I've talked about Asher a lot. He's 7 and he's losing all his teeth. He literally has no teeth right now. I mean, he cannot. I keep sending an apple for him for school, and he keeps bringing it home. He's like, "Mom, I literally cannot eat an apple. I'm missing all of my teeth." But they're all coming in what I'd say kind of yellowish. I mean, I'm just so used to these really cute, perfect, pearly little boy teeth. And now all of a sudden, these giant teeth that are coming that are slightly yellow. Is that normal? Do you get that ever? Is there anything we can do for whitening of those? What's the scoop on these new big kid teeth, Nene?
Yeah, I would say that's probably one of the most common questions I get from parents, just because I do
Okay.
a lot of 6, 7, 8-year-old kids. They're all going through that same phase that Asher's going through. And that's a super common concern.
Okay.
But we always tell parents is what you're seeing is adult teeth, just baseline are darker than baby teeth. Baby teeth are so cute, uniform in
They're
color,
so cute.
pearly white, perfection. And then we have our adult teeth that just baseline are darker, have more irregularities in them, more shade differences. And at that 6, 7, 8-year-old mark, you're seeing a huge contrast because you're seeing these adult teeth that are not quite as cute flush up against these pearly white baby teeth. And so a lot of parents will really notice it at that age specifically.
Yeah.
We always tell them, give it some time. It is normal. Don't do whitening on kids. Bleaching is, like Bella said, super safe. It's just studies, like most things in medicine, have not been done on kids. So we just don't know how it affects their teeth, how it affects their health. So we definitely don't encourage bleaching. And I would say the main thing is just improving oral hygiene. A lot of times parents that kind of have those questions, when we kind of dig a little deeper and ask some more questions about what their day-to-day habits are, there are areas for improvement, which will definitely already improve the shade of their teeth.
What are some of those areas of improvement as the mom that is asking that question?
Yeah, so I would say a big thing for me is making sure an adult's helping with brushing. It takes a surprising amount of coordination and kind of dexterity to be a good brusher and a good flosser. And most parents, I get it. I'm a parent too. You're busy. It's hard to spend those couple of minutes brushing your kids' teeth. A lot of kids don't like it. But if you start early and you just establish that as that's the rule, like this is mom and dad's job or whoever the adult is in the room, then it can be a really good thing for you to do for them so that you can make sure it's being done right. So I would say just making sure an adult's staying involved with brushing for longer than you would anticipate. So usually I recommend parents still stay involved with brushing until around 6, 7 years old. Like all of my daughter is at 7 and we let her start, but we still finish up her brushing. And that's also around the age they're starting to get their new permanent teeth. So we're like, we want these teeth to stay super healthy.
That's really, really helpful. Okay. I'm definitely going to be supervising from now on. I'm totally guilty of just letting our kids, wait, did you brush your teeth? Okay, good. It's bedtime. Trying to get everyone to bed. But I think reminding people to just be supervising their kids, even if they seem like they're big kids, just to make sure we're taking care of those. So that's really, really good advice.
And Claire, so for you as a dental student, when people find out you're in dental school, do you already start to get questions about teeth?
You'd be surprised. I just mentioned I'm in dental school and it opened up a whole can of worms. Everyone starts dropping all of their dental history on me, no matter where I am. Yeah. But a question I get time and time again, which kind of surprises me, but maybe that's because I grew up in a dental family, is do I actually have to floss? And
do we?
Yeah. and to me, that answer is pretty obvious. Like, yes, you need to be flossing every day, but I feel like some people don't believe that that's a real thing. And I just feel like if you like something as simple as flossing every day prevents so many problems down the road. So I definitely say yes, you 100% should be flossing every day. I don't know where it got mixed up that you don't really have to.
Well, it just takes so much time. It's like, I'm like, oh, I just
time.
go to bed. Okay, but do you have to floss twice a day or just once a day? Should I be flossing every time I'm brushing?
Flossing prevents periodontitis, which a lot of people don't know, which is a disease that happens as you get older. So when you're young and healthy, like a lot of medical conditions, you're like, oh, everything's fine. Why would I floss? But as you get older, you can get bone loss related to, well, Rini can talk more about this because her husband's a periodontist, so focuses on this specifically. But flossing is really important to prevent that progressive disease as you get older, which can cause your teeth to get loose, fall out, all things that we don't want.
Okay, so along those lines of flossing every day and kind of maintenance, do we really need to be going every 6 months for checkups? Is this a real thing?
We get that question a lot. Definitely you want to go twice a year. The quote I always say is dentistry doesn't get cheaper with time. So if you're going regularly for those 6-month appointments and then once a year for your x-rays, we could definitely catch things early, do a lot more preventative dentistry. Definitely helps keep the teeth long term if we can keep a closer eye.
Serena, along those lines, I remember when I was pregnant, I would always be like, do I really have to go for my checkups? Like, I'm going to like literally all these doctor appointments for the baby and ultrasound. Do I really have to throw in the dentistry too? Should pregnant women be going to the dentist every 6 months also?
Definitely. A lot of pregnant women with hormone changes can get what is called pregnancy gingivitis, where your gums become inflamed, red, uncomfortable. So it's very important to still be going every 6 months for your dental cleanings so that you can keep that from coming back.
And I was just going to add to it, like, that's also, you can still get dental work done while you're pregnant, and it's still really important to address those issues, whether they're cavities, abscesses, periodontal disease, whatever it is, so that it doesn't become an issue. And you can actually, there's like a big connection between motherhood dental health and your baby's dental health. So you want to address those issues. But the second trimester tends to be the safest trimester to get dental work, just because in the third, you're just kind of uncomfortable and don't want to sit in the chair. And obviously in the first, there's a lot of development going on. So the second tends to be the safest.
It's definitely important to still be going every 6 months. Pregnant women with the hormone changes can have pregnancy gingivitis. So you want to make sure you're still going for your 6-month cleanings.
Okay, that's really, really helpful because it does feel like one more thing to add on in already busy time. So knowing that is what we're supposed to be doing and reminding women, even when they're pregnant, that you do have to still go. It's really important. Preventative care, I think, is something that we just want to make sure that listeners leave here remembering.
So what about at-home care? Because I know Bella and Claire love their electric toothbrush. They love it. Travel everywhere with those things. So is there a specific toothbrush that you would recommend? Is electric better? Also with floss, like the different types of floss, like this old school kind or the little plastic ones.
When it comes to dental products, I'm like, whatever you will use. So when it comes to toothbrushes, you want a soft bristle toothbrush. You don't want anything that's going to be too abrasive or rough on your teeth and gums. But whether that be manual or electric, I do love my electric toothbrush. But if you have a manual toothbrush and you're going to your dentist and they're saying, you're doing a good job with your at-home care, the handheld flossers, they're not as good as the regular floss just because you can't get the same wraparound. You want to really hug each tooth while you're flossing, and you can't really do that with the handheld flossers. But again, if it's no flossing versus handheld, I'm going to pick handheld. So it's really whatever you'll use most at home. Home hygiene is really about consistency, and a lot of people have trouble with that. So rather than focusing on which product should I use, really you just wanted to hit that 2 times a day for brushing and at night for flossing.
I've been noticing recently a lot of my friends are getting braces and Invisalign in their 40s. Why is that? Are teeth shifting over time, or why is it all of a sudden in their 40s? Serena, I remember our mom got Invisalign or braces when she was in her 40s too. So I feel like it is a trend that more and more women are coming back and getting braces in their 40s, and more women are getting Invisalign. So I guess, why at this point in our life are people doing it? And what is the scoop on Invisalign versus a more traditional braces?
So I would say a lot of times why people in their 40s end up needing Invisalign or brackets again is because, originally they had braces as teenagers and clients, you may be good about wearing your retainers for a year or so, but then everyone drops off the wagon. What everyone should know is retainers are nighttime for a lifetime. So if you're not wearing your retainers,
that's good.
Teeth are going to shift. Even if you were to go back into Invisalign or brackets after you're done, you want to be wearing that retainer every night because your teeth will shift without that retainer. In terms of pediatrics and Invisalign versus brackets, a lot of times people tend to go toward Invisalign because your home care can stay the same. Your brushing and flossing routine doesn't have to change as if it does with brackets. You don't have to worry about, decalcification from the cement with the brackets. But I think going back to your question, a lot of times why people in their 40s are ending up going back and doing teeth movement is because we all weren't compliant wearing our retainers forever.
Yeah, I actually have no idea where my retainer is. I haven't seen my retainer in 20 years. So it kind of makes sense why my bottom teeth are just completely shifted. And I'm definitely going to have to come have you look at it next time I'm there, because I think I'm going to fall into those 40-year-old women who are getting Invisalign that I'm asking about. So totally a selfish question. And I wanted to just touch on, so did you say something about pediatric and Invisalign? So kids can get Invisalign too?
Yeah, absolutely. I mean,
Okay.
it's anytime kids need orthodontic treatment, there's always the option of going to talk to an orthodontist or a general dentist that does it and figuring out what's the best option for that child. So it obviously depends on the age, what their orthodontic needs are, what their compliance is going to be. I always tell parents you have to know your child to know if they're going to wear their Invisalign trays or not. When we say Invisalign, we're just kind of using it as people use like Kleenex and Q-tips. It's like a specific brand for clear trays, but there are brands for clear trays. It's just kind of, we're using it in that sense. For if you're going to use clear trays for orthodontic needs, it can be really good because then they can take them out, brush, floss, do all that kind of stuff. But if a 10-year-old is not going to wear them, or they're going to lose them all the time, then it's issued for parents.
Well, that would have been nice, Ashley, because Ashley had years and years of braces and a mouth guard, and literally I still have nightmares of sleeping in the same bed with her.
I was going to ask about headgear, Dr. Nina. I mean,
still
people
bring
headgear?
And now they have a different appliance that's kind of more inside the mouth as opposed to outside the mouth.
It wouldn't scare Sonia.
It wouldn't scare Sonia, exactly.
I would literally wake up and be like, "Oh my god, who's in my
You wouldn't
bed?"
look
like something out of a sci-fi movie.
Huge cage. It was like
But look at my teeth now;
nightmares
they're so
30 years
straight,
later.
so it works.
I mean, you do. Your teeth are perfect. So whatever they did, it was perfect. But wait, can you do headgear with Invisalign then, or no? Right? Because that's for the brackets, or maybe the kid might not be a case for Invisalign if they need
most likely if they need headgear, most likely they are not a candidate for Invisalign.
Right. Okay, so maybe there are less kids walking out around there with like nightmares about their headgear. Okay, I know that we should probably wrap up soon, but I do have to ask you the question I get asked as a doctor. That's a dental question. I'll literally be out somewhere at a restaurant or something, and someone will come to me like, "My tooth hurts. Do I need to go in?" And I'm like, "I have no idea. Like, I literally have no idea." So what should I be telling these people when they come up to me asking them about tooth hurting? Just they should go in, they need to see their dentist, or what is the answer that a dentist would give someone to that question at a cocktail party?
So usually by the time the tooth starts hurting, there is, a bigger issue going on. So you should definitely make an appointment with your dentist, get an x-ray, and find out what's going on. It's always better to be proactive than reactive, which is why we'll come back to that twice a year for your cleanings, once a year for your x-rays, because things can progress very quickly, can turn into an abscess or infection. So if you're having pain, you definitely want to go to your dentist immediately and get an x-ray and find out what's going on.
Okay. And actually, I lied. I actually have one more other question along those lines that just reminded me for Nina, or when people come up to me and they're like, "My kid has a cavity," kind of along the same lines, do I really need to fill it because these teeth are going to fall out? So I think that's a really important question I do want to touch base on, because I think a lot of listeners might have that same question. Do you mind covering that one really quickly?
Yeah, absolutely. I mean, I think it just depends on how old the child is, what the reasoning is for saving that particular tooth. Baby teeth are in the mouth for most people until about 12 to 13 years old for these back teeth. They're used for speech development, obviously eating, space maintenance for your permanent teeth to come in. So they have a lot of important purposes. It's not always super black and white of yes or no, but I think if your dentist is recommending it, and you can just ask for a lot of transparency whenever I'm recommending treatment for my patients. I'll show the parent the x-ray so they can see exactly what I'm looking at. So there's no mystery of why did they recommend it? This doesn't make any sense to me. I'll tell them how long that tooth's going to be in the mouth, what the risks are if we leave it, all that kind of stuff. So I think it's just about a conversation with the dentist to figure out what the pros and cons are. If a patient's 10 years old and they're about to lose the tooth in the next year, then I won't recommend a filling for it. So I think it's just about having that conversation with the parent.
Yeah. And a lot
of transparency.
Yeah. And a lot of times as a general dentist, these baby teeth may be sitting against a permanent tooth. So if you leave that cavity too long, even though that baby tooth is going to be, coming out, it could have already spread to that permanent tooth, which they will be keeping.
Got it. That makes a lot of sense. And so I feel like I'm armed now with what I can say to people when they ask me that.
But one more thing you can tell them, just like a little tip, is that cavities do grow a lot quicker in baby teeth than they do in permanent teeth. So whereas in teeth, you might hear a dentist say like, oh, we can watch that. And then a few years later, you'll have to treat it. In baby teeth, that 6 months can make a big difference in terms of being just a filling versus being an abscess tooth that, a 4-year-old's having a lot of pain with.
Got it. Well, that makes a lot of sense. Okay, I just want to summarize for our listeners some of the points that we made today. So number 1, floss every day. That is correct. You should be flossing every day. Go to your checkups every 6 months, even when you're pregnant. Super important to keep those maintenance appointments. So make sure you're going for every 6 months. That is preventative so that we're trying to catch things really early. Invisalign, there are pros and cons to Invisalign and the kind of traditional bracketed braces that we think about. Invisalign might be an option for kids, so make sure you're talking to your doctor about that. In terms of electric versus handheld toothbrush, really it's whatever toothbrush you're going to use because you need to be brushing your teeth. And along the lines of brushing your teeth is make sure you're assisting any kids in brushing their teeth, even when they're kind of grown-up kids, 6 and 7 years old, making sure that they're doing good mouth hygiene. Those baby teeth that come in, they might be a little bit yellow. So if you're a mom like me that's looking at the new mouth of all these teeth are really awkward and missing those little tiny baby teeth, it's very, very normal. And it's normal for them to be a little bit more yellow. So I think in the end of the day, just make sure you're going for your checkups and talk to your dentist about any questions. If your tooth is hurting, talk to your dentist. You probably need to go in for some sort of checkup. So I appreciate you all so much. And this is really fun. And I hope you guys have a great rest of the day and happy Easter.
Thank you.
Thank
Happy
you.
Easter.
Thank you for having
guys.
us.
Bye.
Okay, this meeting is adjourned. Love you guys.